Hey everybody, it's Dr. Swet Chaudhari, board certified plastic surgeon. So another question I get all the time is, what does it really mean to be a board certified plastic surgeon? And that's an excellent question. So let me start right here. All doctors have to go through some kind of education and training to become whatever kind of physician they want to be. After having gone through 4 years of college to get a bachelor's degree and 4 years of medical school, you graduate with a medical doctor degree, okay? And that means basically that you're a doctor of any kind, but you haven't figured out what kind of doctor you're going to be. And that's where residency comes in. Well, what is residency? Residency is that on-the-job training that lasts many years, okay? And that's when you're actually learning how to take care of patients. Now, residency training can vary in different lengths. For example, pediatricians have to go through 3 years of residency training. General surgery is 5 years. Plastic surgery is actually 6 to 8 years, depending on which program you go to, and that includes all your general surgery time as well. So we're talking about a long period of time, working about 80 hours a week, which is about 3,000 hours a year for 6 to 8 years. So you can see we're talking about a very long time doing all this training, okay? And then you get out into practice. So who is the board? Well, the American Board of Medical Specialties is the overall large governing body that oversees all the other medical boards underneath them, okay? They're the largest physician-led specialty certification organization in the U.S. They maintain a rigorous process for the evaluation of physicians that are currently in practice. They set a very high standard for board certification, and that's why only 80% of U.S. physicians are actually board certified. They oversee the 24-member boards. They oversee 24 other member boards that cover the different specialties of medicine. For example, the American Board of Pediatrics, Radiology, etc. These are some of the member boards. The American Board of Plastic Surgery is one of those 24 member boards. But the American Board of Cosmetic Surgery is not, I repeat, not a recognized member board and does not have a residency training program. And that's really important as you're choosing your doctor. So what does it mean to be a cosmetic surgeon versus a plastic surgeon? Well, believe it or not, in the United States, any medical doctor with an MD or a DO and a state license can perform any surgery they want to, okay? There's nothing, no one's saying that you can't do this or you can't do that. A cosmetic surgeon is not a plastic surgeon. A cosmetic surgeon is any kind of doctor. We're talking about emergency medicine, pediatrician, OB-GYN that decides to perform cosmetic surgery after doing a few days or a few weeks of training. There is no residency training program in cosmetic surgery, and that's why the American Board of Cosmetic Surgery is not recognized by the American Board of Medical Specialties, and that's really important. So going back to this slide, the American Board of Plastic Surgery has a rigorous process to become board certified. After being out in practice for a given period of time, you then have to pass a written examination first. After you pass a written examination, they then collect all your patient data, all your patient charts, and your outcomes for a period of 9 months. And they critically look at all that data, and then they're going to give you an oral examination. So the oral examination is also given by other board-certified plastic surgeons, and they sit there and they grill you face-to-face on all kinds of scenarios, including your own patient outcomes as well. And after passing all that, then you can become board-certified by the American Board of Plastic Surgery, which is that board right there. So, does board certification really matter? Well, in a lump sum, yes. Actually, it does matter quite a bit. A board-certified physician in any specialty achieves the highest level in their field. They've passed rigorous examination and peer review, they've demonstrated a strong grasp of knowledge, and they're capable of handling both common and uncommon scenarios. And, most importantly, they can be trusted to put your interests first. Okay? After becoming a board-certified plastic surgeon, you can then be invited to join the American Society of Plastic Surgeons, which was founded in 1931 and has over 8,000 members worldwide and only accepts board-certified plastic surgeons. So how would you find your surgeon? Well, the best way to find them is to go to their website, plasticsurgery.org. That's what it looks like. And you can search right on there to find a board-certified plastic surgeon to trust for your plastic surgery. Thanks again.